is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Good afternoon, Philippines. You're watching the Business Portal, your gateway to health, beauty, trends, and opportunities. I'm your host, Dr. Jan Seneca for What's Up, Doc? Yes, and what a very shiny afternoon. And of course, together with me is my co-host, no other than a good-looking, gorgeous doctor, a cosmetic surgeon, no other than Dr. Rayran Lau.
Yes, good afternoon.
Yes, good afternoon, Dr. Seneca.
Good afternoon to all the televiewers of GNN, especially our program, What's Up, Doc?
Yes, and you know, Dr. Lau, we have a foreign guest. Yes, and he's also a physician.
A world-renowned
A world-renowned orthopedic surgeon and a sports medicine specialist. He's based in Dubai and owns several hospitals in Dubai.
Owns several hospitals.
Big time. And also, he's also a doctor of
Famous athletes.
athletes, celebrities like Tom Cruise,
Like in the picture, Roger Federer.
Roger Federer, yes, and he can heal miraculously.
Yes.
So I'm very excited to introduce our guest for this afternoon, no other than Dr. George Jan. Good afternoon, Dr. John.
Good afternoon, Dr. Jan.
Thanks for welcoming. What's up, Doc?
Yes.
I'm excited.
Is this your first time here in the Philippines?
Not really, not really.
Not really. Oh.
So we've been here
I come,
several times.
Yeah, quite often.
Quite often.
Yes.
That's because, you know, because Dr. John is he is married to a Filipina.
Oh,
and,
really?
of course, you know, Filipina are the best wives. Nobody could attest about. Everybody could attest about that.
That's true.
Right. Yeah. So, why? First of all, I would like to ask about your personal life. Okay, why Filipina? For all those girls
God.
all over the world, being a very famous doctor and married a Filipina.
Maybe I didn't expect that question.
The first question.
You were caught, huh?
Very hard. Huh?
See, it's destiny, right?
Destiny,
It's,
there you
it's
go.
like you walk in your professional life and you reach heights and heights, and suddenly you lack something which need to be filled in by a partner. And luckily and fortunately, you know, God bless, and I found my wife here, you know, in Venus.
Yes.
And found her in Dubai, so it's like she understands me, support me.
Oh.
And after that, I saw my life even climbing higher and higher. So
Yes.
I believe it's a right kind of a fit.
So she's your lucky charm.
Yes,
It's just-
definitely.
I think it's,
Yeah.
they said that Filipinas are the best wives. Very caring.
Is that true, Dr. John?
So far, it's true.
And her name is
So
her
far
name
it's
is
true.
Venus.
Venus.
Yes,
Yes,
name is Venus.
So did
Yes.
you meet in Dubai or
Yes,
in Dubai?
Dubai. Yes.
Wow.
So
Yes. Dr.
yes,
Seneca.
because you're engaged in sports medicine, and of course it's a different kind of specialty, and it's a subspecialty of an orthopedic surgery.
Yeah.
And being a sports medicine doctor, what do you mean by that? I mean, being in sports medicine.
As you see that, you know, when you become an orthopedic surgeon, you do everything, yeah? I was
Yes.
an orthopedic surgeon. I
Yes.
do spine, I do trauma,
Fractures.
everything.
Hip
Then
replacement.
I thought it's a fine-tuning. The orthopedic can be fine-tuning, and sports is my ingredient in my life. My dad was a player, my uncle was a player, my sister was a Indian national hockey player.
Oh, you're
Yeah.
really involved in
Yes,
in
family
sports,
in
right?
sports.
Family of
Yes.
sports-minded
And I
person.
too myself was a sports guy. I was
Okay.
an athletic guy. I represented India for badminton. So, you know, sports was in me. But orthopedic surgery, once you finish that, I was not really content with that. You know, I just
Yeah.
want to go a little more far. And I thought, yes, let me take up sports medicine. That's
Okay.
my final dream. That's if you ask me.
Because of the love of sports.
Exactly.
After orthopedics, I mean, after medical school, you
Yeah.
go to how long is the orthopedic surgery?
Orthopedic
specialty?
surgery, I took
4
about
years?
9 years.
9 years?
9 years, yes,
Uh-huh.
because
Wow.
I practiced in many aspects in different parts of the world.
That's long.
Yeah.
huh?
Yeah,
9
that's pretty
years.
long.
So
And I
ho-
combined it with the sports medicine. which
And
is about-
when you're saying that you're practicing in different parts of the world, what are those countries that we've been
I mean, I
practicing
started off with
before?
England, you know.
Uh-huh.
So England is my at the budding stage of my career.
Yeah, okay.
That's the time I got into Manchester United football club, and I was the doctor for
You're the
them.
doctor
Yes.
Yes.
for Manchester United.
Yes.
This is very
Yeah.
famous club.
Very famous. When we are talking about 13 years ago, when Beckham, when Wayne Rooney, everybody was there, and
Yes,
it's one of the premium kind of
so you
club.
were there when David
Yes.
Beckham and Wayne Rooney was
Yes,
playing.
yes.
You're the doctor.
Yes.
Wow, how
Wow.
fortunate.
So from there, I moved to Portugal. I worked a little bit in Portugal. I a little bit in Cape Town.
Okay.
So then I moved to Africa. I do my own centers in Africa. You know, it's under my name. I do a tournament in Africa, which is under my name,
GJ.
GJ Cup.
GJ
it's
Cup.
Wow.
like 16 nation football.
Uh-huh.
Then I, of course, in India. Then I willingly starting in Philippines.
Yes.
Wow.
With the-
Is it, this is really your dream before when you were still a child, being a surgeon and eventually a sports medicine
Yes.
doctor?
I mean, I remember there was a very important basketball match going on in India.
Uh-huh.
Then I was already an orthopedic surgeon. Then I voluntarily told them, "Can I be your doctor?" You know,
Oh,
you
I love to.
voluntarily-
Go to yourself. Huh?
And they
volunteer.
refused. And they refused me. And then I said, "My God, you know, they appointed somebody else." And but now I am the legal medical advisor for the Indian national teams.
How ironic.
Yeah, it's, you know, things changes as long as you keep your passion burning
Yeah.
and keep working on that, it'll eventually come in
Yes.
your way.
You know, we were talking offline a while ago, and
Yeah.
we were asking Dr. John, is ACL the most common problem
Yeah.
of an athlete?
But
I mean-
what's ACL
Yes.
in
See, it is what do you say, the strong ligament in your body.
okay.
It is one of the ligament which is commonly injured in your knee.
It's
Oh.
it's in the
Yes.
knee.
Yes.
Yes,
For
okay.
example, you're talking about 200,000 ACL injuries in a year
200,000.
200,000
in
injuries.
US alone.
US alone.
Yeah, so you know, it's a very common injury. You see
Yes.
that, you know.
Yes.
This is one of the ligament will never heal, unfortunately. So you
Oh.
the
most
one
likely
ligament will never heal.
90% you will end up in surgeries.
Oh, 90%.
okay.
And you've mentioned you have the world record for
I
the
mean,
most performed ACL
yeah,
procedure
Surgeries
in a day.
in a day.
Yes.
Yeah.
How many, Dr. John?
23.
23.
How is that possible?
Yeah.
Yeah, even I don't know.
How long is the procedure per?
I mean,
surgery?
procedure is keyhole surgery. So
Keyhole.
you know, in the knee you have just 2 holes on the either
Okay.
side and couple of stitches in the back,
Uh-huh.
and you take your own graft and you put it with some screws, bone screw we call it, and this surgery can be done ranging from 15 minutes to 40 minutes.
15 minutes ACL.
Wow.
Yeah.
Yeah. But usually you don't do the traditional open
No,
knee
I don't
surgery
do. I
anymore.
used to do that. You know,
Yeah.
when we started off, like we are talking about 10 years ago, I started doing open patellar tendon. Sometimes we do in revision cases, even today.
Yeah.
Some other patients come to me, done the surgery 3 times, 4 times. They want the 5th time, so I might take the patellar tendon.
So you have to need to open it.
Yeah, I open it very, very small.
Very
opening.
small.
Yeah, very
Other than this sport medicine or knee surgery, what other surgeries you're doing?
I mean, I am a keyhole surgeon basically, so I do
so
shoulder.
it's like a MIS, no?
MIS, minimally invasive, yes.
surgery.
Yes.
And you know, when I changed this practice back in Dubai 4 years ago, people have told me, you know, you're venturing into a super specialty.
Yeah.
Then I said, it is possible. And if you ask me, I'm most busy now than there.
Oh,
Because, you know, I do about 1,000 scope piece surgeries in a year.
wow.
So it is quick, it can fix things better, and you get a wonderful results.
How about the recovery, Dr. John? For all I know is the recovery for ACL is 9 months, I think 6
I mean,
to 9 months.
6 months you
6
can
months.
get back to game, provided you have a very structured physiotherapy rehab. That's very important, you know.
Okay, so you have to undergo a rehab.
Absolutely.
For a keyhole procedure, is it shortened, the recovery?
The-
Yes,
recovery
absolutely,
time.
absolutely.
Yeah.
You know, we have records, many records of keyhole surgery getting back to game.
As soon as possible.
Yes.
Wow.
Yeah, but these knee problems also most common for age patient. I mean, those old age patient. What is the most common problem for knee for age patient? Like, for example, like any fracture or patellar thing.
Yeah,
or,
fracture is there.
or
Then the
knee-
main
knee
problem
replacement, you know.
we find difficulty, or we find not to want to see in patients is the cartilage.
Okay.
When the cartilage get torn, you know, cartilage doesn't have blood supply, it doesn't have nerve supply,
Yeah.
it doesn't have any lymphatic drainage.
That's true.
So what happens is cartilage healing is very difficult. So we do a lot of surgeries to fix that.
Yes.
Okay.
But as you get older, you have something called osteoarthritis coming into you,
Yeah.
which is more difficult, you know, to treat.
Yes. So
Wow.
in sports, Dr. John, we've heard about news that some athletes sudden death during a game. What is the most likely cause of that?
I mean, see, the sudden cardiac death
Mortality.
mortality is not much, but it can happen.
Oh.
It can happen.
okay.
And
can
it's
happen.
very
Did
difficult.
this athletes undergo, like, we call
Screening
it
for
screening,
I mean,
cardiopulmonary
even if you do a
clearance,
screening,
yeah.
it's like hypertrophy
Uh-huh.
of your cardiac muscles.
yes,
Okay.
of course. So
Yeah.
if you're
So,
an athlete,
it's quite difficult because most of the athletic population do have this one because of the because of the hypertrophy of the muscles. So
Yes,
it's
so-
quite difficult to diagnose and say
So, like heart
do some
enlargement.
preventive measures. Little difficult,
Yeah.
but having said that, monitoring is good. You know.
monitoring.
Yeah.
Because of course the athletes they're investing to their health, you know, because that's how they make money, and other than being a skilled person.
Yes.
So what do you advise for, like, for example, our televiewers who are planning to be, let's say, because here in the Philippines the most popular sport is basketball.
Basketball.
Okay.
Yes.
And other than that, there's a lot of Filipinos who are really dreaming to become a popular basketball player. So, what would be the health advices that you could tell to our televiewers who are planning to go on sports, and how to prevent these injuries?
I mean, the number one thing for me is, you know, like everybody says that you play smart.
Yeah, play smart. There you go.
And then second one, I would say listen to your body.
Oh, okay.
Very important.
Uh-huh.
We have seen from grassroots level to the high professional people, when you don't listen to your body, and body is trying to tell you there is a pain,
Okay.
there's a swelling, you neglect that, and
You don't ignore
you
that.
know, keep doing your match and playing and stuff like that, it can get worse. So
That's
first thing I
true.
would say is that know your body and listen to your body.
Oh,
So if you do that initially, it's much easier for us to take care
right,
and
right.
treat you
So
better.
if you feel something initially, you have to come
have
and
to.
see a sports doctor.
Absolutely, absolutely. And
Yes.
even if it's a minor thing, it comes with your experience. If it's a light strain, yes, you can ice it. You can wait for a couple of weeks, and if it doesn't get better, instead of going back to game, please visit your surgeon or specialist.
Okay. Wow. Wow, talagang matindi, no?
Yes, so
Yeah, and,
for the benefit of our televiewers, please engage in our conversation kasi
Yes,
napakagandang topic
And you
natin.
can also text us at 0925-825 right there in your screen, 0815.
yes.
And please indicate your name and your location where you are at right now if you have any question regarding sports medicine.
medicine,
And
yeah, so-
Dr. George will answer your question. Alam mo, dito sa, you know, in the Philippines, I don't know, but I'm not so much engaged in sports, but sports medicine, I haven't heard that much. Huh?
Not much
It's not
here,
that popular.
not much popular here in the
Here.
Philippines, but in other parts of the world,
Yeah.
it's very popular.
I mean, it's one of the rising specialty, as I said. You know, we are
Right.
one of the initial players in the field because most of them, as I said, they will be happy either as a surgeon, orthopedic surgeon, or there are physicians who are doing only sports medicine.
Uh-huh.
Yes.
So
Okay.
combination is very difficult.
Do you need to be a orthopedic surgeon to become a sports medicine
Not
specialist?
necessary.
Okay.
Not
Oh,
necessary.
you can bypass the orthopedic
Yeah,
surgery.
You can be a physician and
And
take
then a
care
sports
of the
medicine.
Sports
Sports
medicine.
medicine.
Or you can be an orthopedic surgeon trying to specialize in sportsmen. But combination is quite
Much better.
much better because you understand the injury, you understand the sport.
The
Right.
anatomy.
You can, yes, you can give the best to the.
The best care to
Care
a
to the-
patient.
Is it hard to treat celebrities or famous
Famous,
athletes
yeah,
than normal
because,
patients? Is it
sometimes
hard?
there are,
You
we
see the
have-
pictures, yes.
Yes,
oh.
and we have celebrities. You know, you have some inhibition of treating all those because if you commit any single mistake for this particular procedure,
Or if they
it may
cannot-
mess up their
if they cannot
their
play.
career. Yeah.
I mean, my advice would be to start with make sure that you have $100 million insurance. You're
$100
quite
million
safe.
insurance.
I mean, fortunately, I have to have it, so I have that kind of insurance.
Yes.
Because you are meeting players who's earning much more than that. And your decision is something which is going to affect not only him, his team,
Right.
his performance, his matches, and it rolls around something like millions of dollars. So when you say you're not fit to play, you need to be doubly sure, making sure that this
He cannot
player
play.
cannot play.
Can't play. Yeah.
And if you say he is fit to play, you should make sure that
He
he
is
will
fit to
not get
play.
any injury.
So
And
you're
if it happens, and it's your, the level of your expertise will come down.
right.
Because I'm a part of the International Rugby Board, International Tennis, and FIFA.
Uh-huh.
For me, tennis, football, and the rugby is the ingredient for my career. So far every year they'll assess you my judgment on patients and satisfaction of the patients to the board. Then you get satisfaction saying that I've done the right job. And if you miss it, then But fortunately, what we do is that kind of a scenario coming in, it's to be a tough decision.
Right.
We involve other doctors like us.
Yes.
I call somebody from US or somebody from UK, and we take a common decision, and we all three of us sign it, so that you are backed up quite strongly.
Okay. Yes. And did you know, Dr. Lau, that Dr. George Jan is also a movie producer,
Really?
and he caters, of course, all the celebrities like, as I've said, Tom Cruise, Jackie Chan. Yun ang mga karta ng mga patient niya. And yeah, that's one of his movie, Masutra, in the 3D. 3D ba yan? Oh, and,
Dr. John, can you talk about this?
yeah.
What is this
And,
Masutra?
Masutra is a movie produced by Dr. John. And of course, he has this company named Transform. And we'll be talking about that when What's Up Doc returns.
Natural look nose lift, cleavage by breast augmentation, curves by liposuction, non-surgical treatment of varicose veins. Janssen Cosmetic Surgery by Dr. John Seneca.